Hello, my name is Diana, and today I will be talking to you about diabetes type 2. According to diabetes.org, if you have diabetes type 2, your body does not produce insulin or use insulin properly. This is called insulin resistance. In a person without diabetes, the pancreas produces insulin in response to the sugar levels in the blood. However, a person with diabetes type 2 does not have this luxury. Over time, the pancreas stops producing insulin, which causes spikes in blood sugar. Without the insulin to combat the blood sugar, that person becomes at risk for all sorts of problems, which we will discuss later. There are three main types of diabetes: diabetes type 1, type 2, and gestational diabetes. Gestational diabetes only occurs during pregnancy and often resolves itself after the pregnancy is complete. Although it is predetermined by existing diabetes, a person without diabetes can sometimes acquire diabetes after having pregnancy and having gestational diabetes during pregnancy. However, we are here to talk about type 1 and type 2. The main difference between type 1 and type 2 is that the person with type 1 diabetes is born with type 1 diabetes. They are born without the ability to make insulin. The person with type 2 diabetes acquires it over time as the pancreas stops producing adequate amounts of insulin. However, both are treated by monitoring blood sugars and by using insulin. There are several non-modifiable risks, which include genetics, age, and race. Non-modifiable risks are things that you cannot change no matter how hard you try. There are also several modifiable risks, which include your weight and your diet, your physical activity, your blood pressure, and cholesterol. These are things that you can change, and they are the most important simply because they can be changed. By decreasing your weight, eating a healthy diet, and being physically active, you can significantly decrease your blood pressure and your cholesterol, which also help to make it easier for your diabetes. Diet is extremely, extremely important. By eating proper food and decreasing the amounts of sugars and bad fats, you can more easily control your blood pressure and your blood sugar. And as part of a national movement, the Choose My Plate, which was formerly known as the food pyramid, is a visual aid to help ensure that your diet is healthy and you're eating the correct amounts of the correct foods. By using the simple visual aid of the plate and the proportions, you are able to see and choose a proper diet. Exercise is also very important when it comes to controlling diabetes. It is recommended to have 30 minutes of exercise most days of the week. However, not everybody is able to do that. If you are overweight and you have diabetes, any amount of exercise is worth doing. Even if it's 15 minutes per day, it's better than not exercising at all. Eventually, with time, you will be able to do more and more exercise, and you will be able to decrease your weight, your blood pressure, and your cholesterol. Skincare is super, super, super important with diabetics. Diabetics are really apt to acquiring wounds, especially on the feet. By monitoring the skin each day and properly caring for it, there's less of a chance of acquiring a wound or an infection. There are several types of medications that are used for diabetes, and here are some of the oral types of medications and their uses. You have metformin, which is a pretty widely known medication, also called glucophage. You have your sulfonylureas, which are glyburide, glipizide, and glimepiride. You have your meglitinidides, which are Brandon and Starlix. You also have your thiazolidinidiodes, which are Actos and Avandia, and your DDP4 inhibitors, which are your Januvia and your Tradjenta. A lot of people are taking metformin, Tradjenta, and Januvia to help with their diabetes. There are also some injectable medications to help with diabetes. You have your GLP-1 antagonists, which are your injectable Byetta and your Victoza, your SLG2 inhibitors, which are your Jardiance and your Invokana, and then you have your insulin. Most insulins are synthetically made, but they've previously been obtained through animals, which is kind of interesting. You have your rapid-acting insulin, such as Novolog and Humalog, that act in 10 to 30 minutes with a peak time of 30 minutes to 3 hours. You have your fast-acting insulin, such as Novolin R and Humalin R. They act in 10 to 30 minutes and peak between 2 and 5 hours. You have your intermediate-acting insulin, such as Novolin NPH and Humalin NPH, which act in 1.5 to 4 hours, and they peak between 4 and 12 hours. And then you have your long-acting insulins like Lantus and Levemir, which act in 0.8 to 4 hours, and they really have a minimal peak time. How to measure your blood sugar. This is very, very important for those with an unstable blood sugar. You need to gather all of your equipment. You need to select your site that you're going to use to test your blood sugar. You need to make sure you wash your hands, and if you can't wash your hands properly, you need to use an alcohol swab on the site. You need to put the glucose test strip in the glucometer. You take whatever site you're going to use, and you puncture it with a lancet to obtain a blood sample. It's very, very important to wipe away the first blood drop, as it can promote an inaccurate reading. Then you're going to make sure that the test strip touches all of the blood so that the entire test strip is covered in the testing area. And then after you check your blood sugar, you're going to go ahead and put a small amount of pressure or Band-Aid on that puncture site. And you will wait for your blood sugar, and then you need to dispose of all of your equipment. It is very, very, very important to dispose of your needles and your lancets in the red sharps container. You can obtain this through your doctor's office, through your pharmacy with a doctor's order, any place that you're going to get your needles and your lancets. Never, ever, ever put your hands inside the sharps container. It's full of needles. You don't want to do that. And then whenever it's full, you can contact your local fire department or pharmacy to figure out where you can dispose of your full container, and then you can acquire a new one. Measuring your insulin is extremely important. You need to make sure that you're doing it the correct way. You're drawing up the correct amount of insulin, because if you are not, you can really do some harm to yourself. You want to make sure to roll the bottle between your hands. You're going to go ahead and clean the top of the vial, insert the needle into the soft part of the top of the bottle. You're going to turn the bottle upside down so that you can see just how much insulin you're drawing up into the syringe. And you're going to use the top ring to determine how much insulin is in your barrel. You need to make sure to read that at eye level, just so you can make sure that you're getting the correct amount of insulin. When you are administering your insulin, you definitely want to go by your doctor's sliding scale, which is a scale specially drawn up for you. You need to make sure you're giving the correct amount of insulin, again, by using that sliding scale and looking at the plunger to make sure, or the syringe to make sure that you've gotten the appropriate amount. You're going to want to pinch that area. Pinching the area that you're going to inject actually helps to decrease the pain just a little bit. You're going to clean it, and then at a 45-degree angle, you're going to go ahead and insert your needle so that it goes into the subcutaneous tissue. You're going to push all of the insulin in after you release your pinch, and then you're going to wait 5 seconds to make sure that all the insulin is out of that needle before you remove the needle from the skin. Hypoglycemia is any blood sugar below 70. Can have a whole lot of symptoms there. You need to treat hypoglycemia by having something to drink or eat, or having a glucose tablet. And after that, if your blood sugar still doesn't go up, you need to call your doctor. Hyperglycemia is any blood sugar above 180, and you have a lot of different symptoms, some frequent urination and excessive thirst. If you cannot get your blood sugar down, or if it is consistently above 240, you need to contact your physician. Some pretty serious disorders associated with blood glucose are hypoglycemia, which can lead to falls and injuries, loss of consciousness, seizures, and death. And then for hyperglycemia, you have diabetic ketoacidosis, which is incredibly dangerous and typically winds up with a person in a coma in the hospital. Or you have hyperglycemia, hyperosmolar state, which is when the blood sugar is over 600 and the person becomes dehydrated and typically winds up in a coma as well. Conclusion is that diabetes is a very serious condition that must be monitored. With the proper preventative maintenance and preventative measures and following your physician's orders, you're much likely to live a complication-free or minimal complicated life with diabetes.